Welcome to another Facebook Live edition. Happy to have all of you join us today. We are going to be joined by my good friend Avi Benmordechai, who is a clinical psychotherapist. I haven't done a live with Avi in a very long time. I'm actually very excited and looking forward to doing another episode with Avi. Of course, if you have any trouble hearing me at all, please let me know. Let me know if you can't hear me, if you can't see me, if I look like my face is halfway cut off on the screen. Let me and Avi know as well, because without your feedback, we can't tell until after the video is over. So I think Avi is requesting to join. Let me accept him. And we will next live. So with the magic of the Facebook camera rolling, Avi, are you there? Avi is joining. Okay, I see that. There you go, Avi. How are you? How is everything? It's been such a long time.
It definitely has been such a long time, and I'm happy to connect with you today and with all our viewers. This is going to be a tough one.
Why?
You know, I was hoping to get on social media to do a live with you for better circumstances. And based on what has happened in the current times, just overall in the past couple of months, in the past couple of weeks, in the past things that have been happening in the news, has definitely affected us as a whole, as a nation, as a community, as a family, and as an individual.
You're talking about back from October 7th.
Absolutely, starting from October 7th, and what's just been going on in the news and in the community. And I feel like tonight is definitely a time that we need to talk about this.
Well, before
You know,
we begin, for anybody who's joining, I was just saying right before you joined us, many times I know this is like, why is this even important? It's important. If you see our faces are half cut off, we're not focusing on the camera, you have a hard time hearing us, please let me know before we begin the live so that we can make those little adjustments, so that we can be presentable on camera, because that is also very important to us. Let us know. Let your friends know that we are live. Avi and I are live. It's been a while since we did a live segment. Personally, I think this is a very important live segment because it's going to be in the perspective of a healthcare worker like myself, who is a physician assistant prescribing medications, evaluating, diagnosing, and we have Avi here, who is a clinical psychotherapist. You're getting a lot of love there, Avi, who is a clinical psychotherapist who does.
You're half in the camera, they're saying.
Okay, let me know if it's better now. Who does therapy work? So we're going to talk today from a perspective of medical perspective, okay? This is not meant to be in regards to anyone in specific, in particular. We did not come on live today because we want to talk about an isolated case, somebody specific, because the truth really is, even though we chose tonight as being the night that we're going live, is this better? This is why I find it to be important, you see, because I have my viewers which are helping me get on camera right, so that at the end of the show, I'm not going to be like, why didn't anybody tell me I'm halfway off? Okay, I hope this is better. So that we can help prevent certain things from happening. Again, what happens, only God is in control of. We're not saying that anybody has this magical wand and that we're not here to criticize or to talk about anybody in specific. We just decided to come on live today, because I think Avi and I both were requested to do this live. Okay, as you saw, we haven't been live for a while together. We both got messaged a lot, today in particular, to go live for awareness, to talk about mental health in general. So we made time in our busy schedules to do this live. So Avi, thank you very much for agreeing to come on the live. So today I want you to ask questions. If you have a question while we are live, and you want us to address, we will do our best to address it, okay? But just keep in mind, like I said, this is not by any means to talk about any specific family, to discuss any reasons for why things happen to anybody in particular, because we ourselves, me and Avi included, we don't know details of any stories. We're not here to judge anybody. So please keep that in mind, and let's be sensitive to thinking this is associated with anybody in particular. It really, truly is not. So we're going to start off, Avi. Obviously, this was a very last segment live. I am not prepared at all because this was very random. We're going to try our best to just go with the flow. So Avi, I'm going to present my first question to you as it comes to me live. I want to ask you, for the last few months, particularly, as a therapist, what issues have you been dealing with the most? As far as, have you seen people dealing specifically with children, raising children, or marital issues, or self-awareness issues, issues with depression? I know this is a very loaded question, but if you were to summarize what you see very frequently in the last few weeks to days, what would you say is something you're really seeing a lot lately?
It's interesting because as you're talking, I'm feeling a tightness in my chest, you know?
Why?
And I didn't even think I was gonna get so emotional on this live. But it's so sad to see kind of what's going on in the community. It's so sad to see what's going on in the world. You know, when October 7th happened, it so deeply affected me. First of all, I have family who lives in Israel, and my brothers and sisters who live there, you know, the whole Jewish nation. And based on what was coming up on social media and the images that were coming up, I made a decision. I said, I'm going to take a break from social media for 2 months. I didn't think it was going to be 2 months, but that's what ended up happening. And for someone who constantly posts on social media, who's very interactive, who's very involved, I took a break because I said, for my mental health, I needed to make sure not to see those specific things that were coming up in order to be able to help the people that I work with. That is families, that is children, that is couples, that is individuals who are struggling with depression, anxiety, and more specifically, trauma. When we hear the word trauma, a lot of people feel like it has to be something so significant in order for it to be valid. You know, today, as you were saying, that people were texting you, people were texting me right before this live that we're doing. I was just talking to somebody, and they said to me, they said, Avi, you have to go live. You have to talk about this. And I said, what do you mean? They said, you know, it's so sad that it's crazy. I'm shaking even talking about this. And these things usually I'm able to be composed, but the messages that I'm hearing based on people's sharing it with me, they said, you know, when I share my pain with someone, they go in and they say, what do you consider this pain? You consider this trauma? You consider this hardship? You don't know my life. Back in my country, what I was dealing with, and diminish the other person's pain. Unfortunately, as a whole, as people, it's so difficult for many to be able to empathize. What is empathy? What is empathy? When a person is in a ditch, when a person is in a pit, in pain, being able to jump in that hole with them and say, what's going on? I'm here for you. I don't judge you. I am here to understand your story. Unfortunately, because of the stigma that's associated with mental health, with depression, with anxiety, with OCD, people are so afraid to talk about their pain. People are so afraid to share what's going on in their life. You know, there's a concept called smile depression. People have a smile on their face, but in reality, they're broken inside.
I
What are
just
your thoughts?
want to say, Avi, I, for one, appreciate your vulnerability very much. You know, sometimes, like you said, you're not sure why you're getting emotional. Seeing you get emotional, especially you do this for a living, you hear people's problems for a living. I genuinely find it a very high level of respect to see somebody like that get emotional, because it means that you have feelings. It means that you understand pain. When we are so accustomed, you know, when I speak to patients and I say you need to see a psychiatrist, you know, one of the reasons they don't want to see a psychiatrist and they're very hesitant to see one is because they almost feel like they're going to be thrown into this box and they're going to be labeled and nobody's going to care about them. They're just going to have this like cuckoo label that they're not normal. And then I realized that's the biggest fear. It's almost like they don't want to be given a title, a label of somebody who's not mentally normal. And then I present it to them. But as I kind of give them that referral, I hope and pray that the person who's on the other end, who's going to be receiving my patient, is going to be as empathetic as myself, for example. Somebody who's going to understand pain, understand what it is to be sympathizing, to be sensitive, understand what it is to come from this person's perspective. You know, you and I, last time I texted you and I told you, Avi, I don't know how you do this. And then you said, what do you mean? And I said, it's so hard to hear people's problems and not let it get to you. I realize more than ever before, people are telling me problems, right? And I would never even like dream that their depth and magnitude of what people really go through is at such a high level. It's almost like you said, smile depression. You see people walking in the streets and they smile at you and they look so glamorous and they look good and they may be driving a fancy car and they have a good reputation and they're well known or whatever it may be. It may look like life is amazing. They don't need us to help them. If anything, they need to help us. We have no idea as to what people are going through. And again, of course, people are not out there to put a banner and say, by the way, my marriage sucks. By the way, I'm being abused. By the way, I don't even talk to my own mother for the last 5 years of my life. Or whatever the situation is, they're not going to carry a banner and hang it up on themselves for you to realize, hey, I'm in pain. It's our job to pick up clues. And we may say to ourselves, well, who is us? Me personally, whose job is it? It's the people that are closest to you. They need to be intuitive of, is there a change in this person? Is this person looking different? Whether it's a spouse, a child, a parent, a loved one, somebody close, a roommate. You need to see when somebody is not the same. It's not enough just because you see them forcing themselves to go to work every day, forcing themselves to do what they have to do. They don't have a choice. But are they in a dark place? Is something really going on? And not like you said, Avi, before, shut it, shut it, shut it, shut it, because it's almost like, well, what do you know? What kind of problems do you have? I also raised children. I also went through this and I also did that. Right, because you were mentally equipped to deal with that. And not everybody's mentally equipped to deal with something. And it doesn't mean that if you're not mentally equipped with something, don't feel bad about yourself. You're not a bad person. I always tell patients, just because you have to go and get treated for depression doesn't make you a bad person. Nothing is wrong with you. It's like getting treated for diabetes or, God forbid, cancer or high blood pressure. Do you feel bad that you have to take a blood pressure medication? Do you feel bad that you have to check your sugar every day for your diabetes? So why do you feel bad when you have to treat your brain? It's also part of the organ. It's all a matter of presentation. How do you present it to the patient? So Avi, I want to ask you a question. I know people that are watching, they may be wondering, like, they may be a little bit nervous in a way, like, is there something I need to look out for? What do you think what are some signs and symptoms? Let's start with children, okay? We'll go with children. What are some signs that our children are going through something related to mental health? What are some red alert signs?
Excellent question. Before I answer this question, I want to also mention something that you said about who is the person that you're working with. It's so important that you're also paired with either a therapist or a physician or a clinician, somebody who's the right fit for you. Because I agree with you, every single time I open that door, with every client that comes through my door, I always say, God, please put the right words in my mouth so I can help this person. Because in the end of the day, I'm just a person. So you want to find somebody who's never going to judge you for what's happening on in your life. Somebody who's going to create a safe space for you to be authentically you. A lot of the times, now to answer your second question, a lot of the times parents have a very difficult time having these deep conversations with their children. Let me give you an example. Let's say a husband and wife get divorced. The mom, now the child is with, let's say, the mom. Just giving an example. And let's say the child is 6 years old, 7 years old, right? A lot of people might think, what does this child know? He's playing. What does he know about divorce? And all of a sudden, you start to see certain behavioral changes, right? Teachers are complaining, school is not done, he doesn't play like he usually used to, he's more withdrawn, he's more isolated. And most importantly, sometimes children are so in tune and they're so smart that they know that the family is experiencing a trauma, so they mask everything as if, and they try to maintain some sense of normalcy in the family. They try to be a good child. They try to get up. It also goes the other way. Not only will they act out, but they can also start behaving so well because they feel like maybe it's my fault. Maybe my parents got divorced because of me. And maybe because if I'm good, they might get back together. What happens? So you might say, Avi, but isn't that a good thing? This child is behaving so well. Absolutely not. Because this child is actually carrying baggage which will eventually express itself later on in life. And parents sometimes are scared to kind of poke the bear in a sense and talk about painful, difficult conversations. And therefore they avoid it. And they feel like if we avoid it, it never happened. It doesn't exist. No matter what age, no matter what age, no matter what gender, this must be talked about. Every single developmental stage of life. They don't wait until they're teenagers to talk about these difficult topics. This has to start from day one. And a lot of the times, parents are scared and parents are uncomfortable. And for you parents, if you're listening to this, no worries. There is help for you to reach out and say, how do I talk to my child about this? It's these types of conversations are not taught in school, right? For someone like me who went to school and studied human behavior, who researched the patterns of thinking, this is my role. This is kind of what I do. And guess what? I want to just share this publicly. I'm a therapist, and I've been a therapist for quite some time. And I'm in therapy as well. Every week, I meet with my therapist. Now, you might ask me, Avi, you're a therapist. Why do you meet with a therapist, right? Don't you know everything about therapy and how the brain works, right? Well, guess what? I'm also human. Just like a police officer who's on the job and needs to meet with a counselor to make sure his mental health is on check. When you texted me that night and said, Avi, I don't know how to do it, I think I even messaged you. This is why I'm also in therapy. Making sure that my vessel that's over here is clear. Because we live in a very scary world today. In a place where...
Go ahead. No, keep going.
We live in a place where we're really trying, especially right now, for what we're dealing with as a nation. It's almost like survival mode. Every single day we hear something else. Every single day we hear something else. This is not normal. It's not normal to live in a world like this. And therefore, we need one another. Forget therapist to client, human to human. And unfortunately, the society has created itself in a way where there's so much judgment. So when a client goes to a therapist, they know this room is like Vegas. What happens in Vegas stays in Vegas. It's a safe zone. Whatever we talk about here stays here.
You said something very important, and I'm going to pick up on that. You said you went through training, and that's how you know what you know. You were trained. Now let's take it aside from therapy. Now let's talk about medical doctors in general. Now this is not a show about medical doctors and therapists. I just want to bring a point here to show you the importance, and not to you, to the viewers here, of what it means to go to a trained professional and not taking matters into your own hands. I had a patient, okay? This is about being a trained professional. This is why it's important to reach out to people who are trained. Do not take things into your own hands. Do not think, I'm going to give him valerianka, he's going to be calm. You know, he hasn't slept a little bit. Let me give him some melatonin and Benadryl. Don't take things into your own hands. I had a patient recently who comes in with his wife. Now, the wife is a medical person. She's a pharmacist, okay? And she's also highly educated. And when I asked them, what's the reason for the visit today? On the diagnosis of when, you know, we have little comments of why patients are coming in, it said anxiety. They already diagnosed themselves, anxiety. When the patient comes into my office, I ask, why are you here? And the wife tells me she already knows why she's here. She wants to get medication for her husband for sleep. Okay, she has the names of medications because she's a pharmacist. So she gives me names of what she needs. That's already, okay, so I take a step back. I'm telling you this for a reason. And I'm asking the patient, you really can't fall asleep. Why are you having difficulty sleeping? So he tells me, you know, I'm going to just, because I want to protect the patient's privacy, I'm not going to tell you the exact reason. We're going to make it up. He says, you know, lately I have trouble urinating. I can't go to the bathroom. And I go to my urologist, and my urologist tells me that I have to have some procedures. Something is wrong. I can't go to the bathroom the way I'm supposed to. And he says, I'm so nervous. This is going around for a few weeks now. And I have a procedure coming up next week. And I'm so worried about what's happening with me. I cannot fall asleep. I'm worried about it. So the wife again is telling me, give him something to sleep, because if he sleeps, he's going to be fine. But just something doesn't add up, because there's a reason why he can't sleep. He doesn't even have a diagnosis yet. It's not like he was given a diagnosis and he's so worried about it that it's really putting him in fear. There is no diagnosis. He has a symptom. A lot of us have symptoms. Long story short, as I'm evaluating him, I'm looking at his body gestures and the way he's walking around the room, and just mentally he looks down. I said to myself, I'm going to take an extra step, and I'm going to really evaluate him. And I told the wife as follows. I said, imagine you have a cut and it's gushing out blood. And you just want to stop the bleeding, but there's such a big cut. There's an actual laceration there. And you just gauze. You're trying to just cover it so that you don't see the bleeding. Is it going to really heal? You need to stitch it up, or else the bleed is just going to keep bleeding. How much are you going to gauze? I said the same way, you want to put him to sleep because he's not sleeping for a few days. Why is he not sleeping? What's behind it? Why is his brain not shutting off? Long story short, we have something in healthcare which is called the depression screening. It's the PHQ-9. It's a list of questions. The patient was adamantly saying, I'm not depressed. I said, just give me a minute. Just answer these questions. As I'm asking him the questions, he's looking at his wife, who now I figured his wife even doesn't know what's going on. He hasn't been communicating with her this because he's been suppressing a lot of it. But now I'm asking him the questions. Obviously, he's in agreement that she's in the room. He didn't object to that. And as I'm asking him the questions, how often are you feeling guilty about yourself? How often are you having trouble eating? How often are you having trouble concentrating? As I'm asking him the questions, it's either never, several days, many days, or every day. Every day, every day, every day, every day. It went from something like, I'm not depressed, to major depression. And then there is a question at the end of it, which says, have you had any thoughts of hurting yourself? Now, the wife who's sitting there 100% thinks everything is 100% normal. He looks at me and looks at his wife, and he says to her the following: you don't really know this, but this morning I really felt like I was better off gone. And she looks at him. Now she's in complete shock. And I looked at her and I said, I'm glad we didn't just give you something for sleep. As you could see, there's a bigger problem here. I said, you thought it was better off being gone? Why? He said, because I'm dealing with so much. I'm like, I can't. I'm so afraid of what's going to happen to me. I can't. My brain is not shutting off. I just feel like maybe it's better to just end everything. And at that moment, I knew. I was so happy to have had this conversation, because there is something very deep going on. It's not just give me something for sleep. The patient is in major depression situation here. He needs help. That's the next step, referring him, treating him. But the reason I'm bringing this situation into play here is, for what reason? We have a family member who didn't even know the magnitude of what's really even happening with her husband. She didn't know. She really believed he's not falling asleep. Give him something to sleep. She loves him. She came with him. She's not against him, but she had no idea, because her husband didn't share it with her. And he said to her, well, why should I tell you? If I'm going to tell you, you're going to worry about me. And at that moment, I said to him, Mr. So-and-so, I want you to promise me one thing. You're going to share your thoughts with your wife. From now on, when you feel that way and you feel this darkness and you feel like you're scared and you're afraid and you wake up in the middle of the night, wake her up. Wake her up. I don't want you to go through this alone. Wake her up and tell her, I'm not feeling well. Talk to me, because I don't feel so well. I said, you're going to promise me that you will share your thoughts with her, right? And at that moment, he looked at her, and of course he didn't want to, but he said, and she said, I need to know this stuff. You can't hide this from me. If you don't tell me what you're feeling, how can I help you? I was open. I was able to give them something to open up about. So the whole purpose of what I'm sharing with you is, how much do you really know about what your loved ones are feeling? How much are you really even paying attention to what they're feeling? Just because they're smiling, are they really happy? Figure out, go deep, talk to them. Avi, what do you want to say about this?
As you're speaking, a lot of people carry so much shame with their feelings. And they feel like, if I'm going to share this with my spouse, with my family member, I'm afraid of what's next. And a lot of times also, people won't necessarily check in because that's difficult. It requires emotional availability, because maybe, just maybe, they might tell you, yeah, it's much better off not to live. And then what? A lot of people are afraid to open up a can of worms. This is for others. Now, how about with our own selves? Many people went through trauma in their life. Many people. The percentage, the statistics is super high. So why don't we deal with it? Because it's very uncomfortable. Our brain always wants to be comfortable. And when we dig and go back into times of our childhood, our teen years, when we were younger, a lot of the times people feel like, what's the point? Why do I have to process that? I'm living, everything seems to be working as a cycle. Why do I have to deal with that stuff? The reason why you have to deal with that stuff is because you're walking with the baggage on your shoulders every single day. Think of it, think of trauma as having a book bag. And every single traumatic experience you went through that was not reprocessed was put in that book bag. And every day as you live, you walk carrying this book bag. So how does therapy come in here? Therapy, going to therapy is you very gentle, very with a lot of sensitivity. You open up this book bag. You first explore, what does this feel like for you to be able to open this book bag? Before you even go inside the book bag, you match the person where they're at. Because the idea of opening up the book bag can be so scary. A person who went through sexual abuse, by the way, yes, in our community, in every community, these things exist. That's number one. Number two, trauma in school, whether it's with teachers, whether it's being bullied, feeling like you're not good enough, that is a trauma. A difficulty with not being able to find your partner, your spouse, getting married, the challenges that come with that, that can be a trauma. Not having children or having a child who's not well, that is a trauma. And people carry this with them and just feel like, okay, life goes on, life moves on. I have no time to work on my stuff here. For a lot of people, their life looks picture perfect. Beautiful car, beautiful house, great job, kids look good, but they wake up in the morning feeling yucky. Why? Why is that? If everything looks great, why do you feel so down? It's because you have so much unprocessed stuff that's happening over here.
You're right. And there's a lot of comments I'm reading as you're talking. I see a lot of the same comments. It says, people in our community like to judge. Now let's take a step back. We're going to be judged regardless. We're going to be judged whether we're treated. We're going to be judged whether we're not treated and then something happens. We're going to be judged whether we're too perfect because people don't like us because we're so perfect and they're intimidated by our perfection. They're going to judge us because we're so sloppy and they don't understand why we can't get it together. So let's take something across the board. You're going to be judged, period, okay? You can be walking the right way and they'll still judge you. That's just the bottom line. When we say you have to reach out, who are you reaching out to? Not your community. You're reaching out to professionals. You're reaching out to people that are actually there to help you. Okay? So we're not going to our community and saying, hey, I'm feeling depressed. You're going to somebody who's going to help you come out of it. So in your case, it could be, first you're going to share, hopefully, with your loved ones, okay? Hey, I'm really not feeling myself. I think I need help. And the spouse needs to be supportive and needs to be understanding and not belittle and diminish and say, oh, are you crazy? And that's the part of the spouse. Same thing with our children. But the next step is when you see that there are no one around you that are trying to be helpful, you're going to pick up the phone and make an appointment to see a healthcare specialist, to seek a therapist. And yes, the other barrier, which is true, maybe financially. Maybe people feel like, what if I can't afford a therapist? What if a therapist is very expensive for me? 100%. That is a reality. Some people may think, I cannot afford therapy. That's fine. If you can't afford therapy and you have no one else to talk to, go see a doctor who will accept your insurance, who will lead you to the right mental health professional. There are many organizations that are going to offer you services free of charge. There are hotlines that you can call. All you have to do is realize that there is a problem. Awareness is key. You feel something is off. You're aware of it. Don't think don't suppress it. Act on it. I don't feel good. I need help. Something is wrong with me. Why am I having these dark moments? Why am I having these dark thoughts? Why is my mind not able to shut off? Why am I constantly being told negative things? Once you feel that, that's the time to start looking and seeking help. And forget about judgment. Worry about, how can I feel better? How can I feel refreshed? It's like going to sleep and your battery is still not charged. You don't charge yourself. You feel tired the minute you wake up. That's the worst feeling. So that's why when I say reach out for help, it's reach out from those that can really help you. And really, I think as a whole, and I think Avi, you can agree with me, in the beginning, before we even did these lives, we also felt like people will judge us, right? Like, who are we to come here in public and have all these people watching us and sharing? And, be honest, I'm being completely honest, we didn't want to do this because we too felt like we're going to be judged. But you know what? Just like exercising builds muscle, and that's how you get muscle and you become strong. The more you exercise, the more you pick up the weights, the heavier it's going to be, the weight. Same thing. The more you start to care less about what people will think about you, it's just literally like, it's something we have to work on. Stop caring so much about what everybody is going to say. You see, my hands are moving right now. Even that was a problem. Somebody decided to make a huge post about why people shake their hands when they talk. You know what I did? I laughed at it because at the end of the day, that's how I talk. I shake my hands. That gives me rhythm. That gives me emotion. That allows my brain to think and function. Is it going to be everyone's ability to focus and pay attention? Maybe I'm not a speaker for everyone. Those that can watch my hands shaking, they're going to continue. Those that cannot, they can move on and scroll along. My point is, you're not going to please everybody. You're not going to make everybody love you equally. They're going to talk about you, whether you have mental health issues. We're going to talk about you, whether your marriage is going down the drain. You're going to be spoken about whether your children are perfect or not perfect. You need to choose which part of them speaking about are you going to be okay with. And the truth is, we shouldn't be okay with any of it. This needs to stop. The fear of what people are going to say because I have to reach out because I need mental help. So because I'm worried about what people are going to say, I'm not going to reach out for mental health. And at the end, it's going to punish my children, my family, my kids, and everybody else. I don't think that's a good choice. And I'm not judging anybody's decision. I'm just saying we need to really work on how we perceive people judging us and block it. Don't allow it to get to you. You need to stop caring. That's just how it is.
One of the reasons why people do that is because they need some more support in strengthening their values. A lot of the times we have a difficulty with being authentic because we're weak in our values. What are our values and intentions? Why are we doing something? When we're able to recognize our why, it's so much easier being authentically you. Like tonight, for example, we didn't expect to go live. You had different plans, I had different plans. But you know what? Tonight I said, I'm gonna do something different. Because when October 7th happened, I took a pause. I needed to work on my mental health. I needed to regroup. I needed to be able to understand the complexities of the situation before I'm able to go live or on social media or Facebook or whatever. But this time around, I said, no, I'm gonna talk about this because you know what? We're in this together. And if we're not gonna have this conversation, and yeah, this might not be perfect and things might be off, or your video might not be leveled, or you might be talking with hands and vice versa. But you know what? If we get our message across, and if one person watching this video right now, if this changes one person's life or difficult situation, or even puts a thought in your head, my job is done.
Right.
Because unfortunately, and it's interesting, I just started a new podcast. Talk about plug, right? I just started a new podcast. A few people actually messaged me and they said, why did you start a podcast? You're not getting any money from it. You have to pay to produce it. What's the point of this, right?
Mm-hmm.
And my response to them was, this is my way to give back. You know what, Yocheved? I agree with you. Sometimes therapy could be costly. I agree with you. For someone like me, therapy is the way I pay my bills, right? It's just like you're a PA, that's your job. I'm a therapist, and that's my job. That's what I love what I do, but in the end of the day, that is my job. Whatever I do outside on social media, and sometimes I'll do free different events for children or whatever it is, that's my way of giving back because genuinely, I very much care. And a lot of the times the messages I get from people is, will this really work? I've been depressed for so long. Can I actually change? I have OCD for such a long time. Can I get my life back? I have trauma that happened to me when I was younger. Can I live a better life? Absolutely. 100% yes, absolutely. Just like things happen to us, we have the ability to rewire our brain. Our brain is a brilliant machine. And if we would just understand a little bit of the power of our brain and how we can change behavior, it's a superpower. It's a superpower. When you were talking about a spouse, you said, tell your spouse. Unfortunately, sometimes the spouse also might not get it because maybe they were raised differently. Maybe that spouse is afraid to talk about it. Maybe they are not emotionally available. And
Right.
What is emotional availability? Emotional availability is to be able to have the capacity to sit with someone in pain.
Mm.
You know, when somebody close to my family, a member of their family passed away, and it was so difficult for many people to go to that person and just be with them. The conversation was, what do I say? I don't know the right words. Sometimes we don't have to say anything. Sometimes just sitting down and saying, hey, I'm here for you. I'm going to create a space, a non-judgmental space for you to talk with me. And I'm going to shut my mouth and I'm just going to listen without giving suggestions and without giving advice. Do you know the concept of therapy? Therapy is not what I'm going to say, the magical words that I'm going to change their life with. The bulk of therapy is simply saying, how was your week? And allowing them to process what happened this week, the things that worked, the things that didn't work, their hopes, their dreams, their failures, their worries, their fears, and creating a safe space like that. Unfortunately, not everyone has this opportunity. Our home should be our safe haven, our sanctuary, especially for those who have children in the home. The way you discipline your children, it's a big deal. It's a big deal. Yelling at them, cursing at them, saying mean words to them, it sticks with them. It stays with them. And I get it. There's no perfect parent. But I feel like we all, as a human race, we can all do better.
Right.
We can all do better.
No, you made some great points. Like you said, not always is our spouse equipped, and not always are our parents equipped. They may not even know how to deal with it. And I think that's why awareness as a whole, we're not equipped. That's fine. Just like you said, we don't really know how to deal with it. But don't add extra salt to the wound by giving negativity, by criticizing even more, by putting the person down even more. Okay, you don't have what it takes. You don't have the skill. You're too busy running around with everything else. And sometimes by accident, you forget to worry about what's really important. Things happen. I get it. People are under a lot of pressure. Sometimes you have a spouse who's working by himself and he has a lot on his shoulders. And even though he wants to be there for his family, he simply can't because he has so much to juggle as far as financial restraints are concerned. Things happen. I don't want anybody to walk away feeling guilty that they're not providing enough emotional support, that they're not there emotionally. But look out. If you see something, do something about it. If you feel like your loved one, a child, a parent, a spouse, a friend, your neighbor, if you see something is off, just like Avi said, you don't have to say anything extra. Just be like, hey, I just want you to know I'm here for you. So if there's anything you want to talk about, please feel free. You didn't hear from somebody in a very long time. Many times our intuition is, well, they don't text me. Why should I text them? Like, they don't care about me. Why should I text them? I'm always the first one to text. Sometimes that gets the better version of us. Stop right there and think to yourself, you know what? I'm in a good mental space right now. Maybe you are, maybe you're not. But if you could say that, then you're strong. Let me just be the better one. Text them. Hey, I haven't heard from you in such a long time. Is everything okay? Don't assume it's okay. Maybe that is everything okay text message. Maybe that saves that person's life because they don't know who to talk to. And boom, your text just came through and they're just like wanting to open up and say, I really feel like I need to go out. Are you available? Or they have nobody to talk to. And all of a sudden you gave them the ability to talk. You never know what your actions can do in someone else's life, because you don't know what someone else is going through. You're judging them by your own life. If you have everything working out, if your marriage is working out, and your kids are working out, and your career is working out, we by accident think everybody else is in the same position. And they're not at all. They're in a totally different position. Their life is not working out the way they want to. Their kids are giving them a lot of stress. Their husband is abusive. Their job is about to fire them. They're going through a lot. And all they want is someone to reach out and say, I am here for you. So I really think, Avi, we gave a lot of important information here. I'm very happy we did this live. I hope that someone watching is going to definitely find it beneficial, that it's going to bring awareness, if anything. If anyone has any questions, please feel free to comment. We will try to get to them even after the show. Feel free to comment. If you think this is going to help someone, of course, go ahead and share it with others. I always like to hear your comments and feedbacks in general. If you want to private message me or private message Avi, please do so as well. And let's just read some comments, Avi. Let's see if we have any comments to read. You want to take
Sure.
over?
And then afterwards, if you like, we can go over a few pointers that I wanted to just go over to make sure not to forget.
Absolutely. Yes, 100%. Go
Okay.
ahead.
All right, let's talk. Marina says the problem is a lot of people are afraid to come out. They're afraid to ask for help. They may feel embarrassed to share their problems. Absolutely. I agree with you 100%. There is shame attached to our circumstance. Do you know why there's shame attached? Because we feel alone. I had a client, a parent who came, and by the way, when I'm sharing information, I'm making sure to change some information to protect the privacy of the people that I work with. I had a client come in and said, my child, who is an older child, is bedwetting. Okay? We're talking about a child between the ages of 8 and 12, somewhere there. Okay? It's not a typical thing for a young child of that age to bedwet, right? Making their bed. And they said, we don't know what to do. There's a lot of shame. The child is embarrassed to talk about it. When the child came into the room, sat on that couch right there, I shared one thing with this child. You know what I said? I said, so many people, especially kids in your school that you may not even know about, they struggle with this too. You should have seen the look on that child's face. The child is like, wait, hang on. I'm not alone. Other kids also do this. They're also dealing with this challenging and embarrassing thing. And I said, yes, sure. Right? Like that look that they gave me when I normalized it for them, it was a game changer. They were able to open up. They were able to talk about what's going on. And shortly after, the behaviors did change, right? We as adults also want to know we are not alone. And this is why the reason sometimes people might say, why are you sharing? You're in therapy. You're a therapist. Don't do that. Excuse me? I am the number one advocate for it. And if I believe it, if I truly believe in it, then I should have no problem to share it. And when I work with kids or even adults, I usually use this line. I say, do you watch basketball, right? LeBron James, great basketball player. Michael Jordan, great basketball player, right? Even basketball players have a coach. Any celebrity, any singer, any actor, they have a coach. Whether it's a musical coach, whether it's a director, right? Somebody looking out for them, somebody seeing their blind spots. We all, as the human race, we all have blind spots. Right. Things that we may not even notice, things that are unconscious to us. Sometimes if we see a certain person, that person might irritate us, right? Why? That person didn't do anything.
Right.
Certain personalities irritate us. They make us feel intimidated. Why? Where is that coming from? That's all the stuff that's up here that needs to be reprocessed. Did I answer your question?
You did very well. Yes, absolutely. Very important point. I actually think there was another very important comment that just came in. Women struggling with postpartum are afraid to open up because what if the
Oh
kids
my
will
God.
be taken away from them? This is not the case. Most of the cases, I feel there needs to be more awareness of what. Hold on. Oh, I always lose this. Of what
I,
the process is when you come in and out and express your thoughts. Mom needs to feel safe to share their scary thoughts. This is very, very, very important. So I myself witnessed in my career somebody who had a baby and has been going through a very, very difficult postpartum depression. I mean, she was requiring high levels of medications. It was not a simple case. And it's almost like people don't understand this topic because they feel like you have a baby, you have so much to be happy about, this is such a blessing, what can you possibly be depressed about? Everybody has babies, okay? We all didn't sleep at night. People just don't understand because it's not so commonly spoken about. They don't realize the mother doesn't want to feel this way. She doesn't want to feel depressed. She doesn't want to feel like this baby is really in her way. She just wishes it wasn't there. She doesn't want those thoughts. It's the abnormalities, the chemical abnormalities that are going on in the brain that are related to giving birth that happen in some individuals that are triggering and that are causing it. And if you're noticing as others, like I said, as your loved ones, the spouse, the parent, if you're noticing a mother who just had a baby, that she's not acting normally, quote unquote, this is something to be aware of. Just because everything in your life went so smoothly and you never experienced it doesn't mean it doesn't exist. What would you like to say about postpartum depression, Avi?
hmm. So I'm contemplating a few different things as you were speaking, where to go with this one. So we understand when a woman gives birth, there's a major chemical change that's going on in her body. As people, on the surface, it looks like, wow, that's amazing. You have a baby, right? Be happy. You have a baby. But unfortunately, that's not always what's going on in the person's mind. Actually, many mothers, if not all, struggle with that. What am I talking about? First of all, number one, what their body went through, the trauma that their body went through, okay, giving birth. The second piece is their lack of sleep, which is a basic human need. If you don't have sleep, proper amounts of sleep, a person can become delirious. When a person is delirious, they do very questionable behavior. That's another thing. Number three, nutrition. A lot of the times their nutrition is off balance. And when you take all of these important basic human needs and take it away from the person, what do you expect? And a lot of the times, mothers carry so much guilt and shame. What's wrong with me? Why do I feel this way? I'm supposed to be happy, but I'm
Mm,
not. And they blame themselves for it and they carry this with them. You know,
mhm.
I'm actually what I was thinking about, I'm still thinking about if I should share it or not, but I'll share it. You know what? For the sake of this live and for the sake of vulnerability and there's being openness from one, forget that I'm a therapist, okay? Can we forget that for a second? From one human to another human. You
Mm.
ready? Just you and me,
I'm
Yochanan, and
absolutely
everybody else
ready.
is
I'm very
watching.
excited to hear what you want to share.
Um, so my wife and I, for those who know, my wife and I, we went through infertility for a very long
Mm.
time. Okay, I mean now, Baruch Hashem, we have a beautiful child. She's doing amazing. But we went through infertility for a really long time. I don't think I ever publicly share this on a live forum. Maybe one day I'll tell the whole story. But you know, when my daughter was born, a lot of people saw me, or the closer people saw me, or when they heard my wife was pregnant, they said to me, "Oh my God, you must be so happy. You must be so happy that you're going to have a baby." And I said, I'm like, yeah, that's for sure. Yeah, I'm happy. When she was born, also, people people saw we had an event, right? And a few people actually came over to me. They're like, "Is everything okay? Like you're not glowing. You're not like, you should, after not having kids for a long time, you should be like on the top of the moon. Like you should be so happy." And I couldn't. I genuinely couldn't be happy. Now, because I'm a therapist, I was able to break it down and say, like, okay, what's going on here? We waited such a long time to have a child. It wasn't happening for many years. And it finally happened. I wanted this so badly, and it finally happened. Why am I not happy? Like, why am I not experiencing the ultimate joy? The reason was, and of course, this is from processing. The reason was because I was really afraid.
Mm-hmm.
I was really afraid to lose this huge gift that I was given. And a lot of the times, people, and because of that, it took me a nice amount of time to actually fully connect and embrace the situation because my system needed to process, like, hey, you're a dad, you're a father, right?
This is real.
This is real. I was in denial. It was almost like it felt like denial for a long time. Like, oh my God, this is my kid. Wait, I'm a dad. And actually, every single time I see my child, I'm like, oh my God, it's like a pinch me moment, right? Same thing when someone loses someone, right? When someone goes through grief, when someone loses a loved one, that first stage of denial, this is not my reality. How is this happening? This did not happen, right? Because our brain needs time to understand what happens. And then you have the 5 stages of grief, right? Which are denial, anger, bargaining, depression, acceptance, and they go up and down and up and down. So this is what I'm trying to say. In the end of the day, mental health challenges don't choose the people. I'll give you a story.
So true.
There was a guy, and I think I said this before, but there was a guy who was a clown, and so there was a guy who was struggling, and they said to him, "You need to go speak to this and this person in this town, and you need to go and tell him your struggles." He goes to this person. He says, "I'm feeling really depressed. I'm having a really hard time." And the person says, "I've got the right guy for you. You have to go to this in this town. You have to meet with this clown, and he's going to make you happy." And you know what this person said? He said, "I am that clown. I
Interesting.
am that person who makes everyone happy."
And he
Why am I
can't make himself.
right? Why am I saying this? Because every single one of us, even if people are looking like they're on top and they're good and they're okay, check in. Check in with your kids. Check in with your spouse. Normalize the conversation of taking care of ourselves mentally and physically and making sure we're able to allow ourselves that safe space.
Avi, I'm so happy you shared your story. And I know it takes so much strength and courage to share something so personal. I appreciate that you were able to do that. The reason I'm so happy you shared your story is because, you see, people have the stigma and misunderstanding in thinking that people who are educated, smart, they have a career, they know better, that they don't have those moments of feeling down, anxious, depressed, worried, sad. It's almost like they're so smart and they're so intelligent. Of course they know how to process information. And it's so important because, like, I've been through moments where I also felt like, oh my God, and I shared my personal story the other day too. So my point is, it doesn't matter how intelligent somebody is. The way we process information is not always what is considered normal or not normal. Everyone has moments of, this is hard for me and I need space and I need time to process, versus, I got this. This part is easy for me. Everyone is different. So don't think because you know somebody and they're highly educated, they don't have mental issues, or they don't need mental support, or they don't need an extra phone call to see and check up on them. That is the wrong way to think about it. So I am so thankful that you shared that story, because you're so relatable to many people who are watching and that have been going through these challenges. Hearing you go through it, even though this is what you do for a living, you talk to people, you allow people to know how to process information. You're being open and honest and saying, hey, I had a hard time too. And that's absolutely okay. You're allowed to have moments like that, but how do you get out of it? That's the real question.
So there's a few different areas. If you want to just, we'll skim through it. We'll just talk a little bit, if that's okay with you.
Sure.
Okay. Number one, let's talk a little bit. It's almost like we'll run through these topics quickly. Of course, every single one of these topics is a whole talk on its own. But just for the sake of this live, because I'm not sure where it's going to go, and I know people are watching. So if you're still here with us, just hold on for a little longer, because I think this is important to mention. Number one is social media. Recognizing a lot of us are on our phones, are on social media, Instagram, Facebook, TikTok, YouTube, whatever it is. We're watching videos and we're seeing people's life and we're seeing how people live. And a lot of the times it can affect a person because they feel like, why not me? Why don't I have these things? It's like FOMO, the fear of missing out on fun things, the fear of missing out on opportunities. People are going on vacations. People are having a nice house and, nice things. People want that too. You may tell me, no, I don't think that. I just look for entertainment. But on an unconscious level, this impacts your brain. So if you notice, a person is noticing, and I'm talking to myself too, if we notice, we're on social media, and there's certain accounts that make us feel this way. And by the way, I want to just say, if we experience jealousy, let's normalize that, right? As humans, it's something that we experience. If you see that you're following an account and it makes you feel jealous, it makes you feel uncomfortable, it puts you in a specific spot, don't follow that account anymore. And also recognize what's coming up for me that I'm feeling jealous. Usually we're jealous of the person because we feel like we want that, and for some reason we have a stumbling block in our way that's not letting us get that thing that we want. So, which bothers us. It bothers us because it's almost like a reminder, like, hey, you wanted this, but you can't have it. And that's where that inner work comes in from. You want to share anything about it? I am
so glad you brought social media into this. Oh my God, because half the things that we see are not real to begin with. You're only going to see the most glamorous part. Like, you see somebody on vacation and you're almost like, how come they get to go on vacation every time? How come her husband treats her out like this every time? And I'm struggling and I'm hustling and I can't even afford to go to the zoo, like whatever, I can't afford anything. And they're constantly traveling. Little do you know, the second that camera goes off, it's not really a vacation at all. Sometimes it's completely not what you thought it was. These people are struggling. There's actually somebody in the background screaming and yelling. You don't even know what's going on there. You see this beautiful, glamorous picture. She looks all put together. Everything looks nice. And then you look around the room and it's a chaos of what's really going on, but you don't see that part on camera. So I'm so glad that you brought up the social media part, because 100% correct. If something is not giving you joy, if it's not giving you a sense of self-worth, why are you going and scrolling through these accounts and just, rubbing it in your face and making yourself feel jealous or not worthy enough? Don't do it to yourself. Get rid of it.
I have a comment to say. The statement, when you were a child, if let's say your teacher was giving out something, right? And she says, you get what you get and you don't get upset. Did you ever hear that, right? Yeah. It's okay. You get what you get and you can get upset. Let's change that type of thinking where your feelings are not valid. Because somebody in the comments wrote here, you have to be happy with what you have, right? Let's be real. That's not always realistic. When somebody has a big family, a lot of kids, difficulties with finances, difficulties with, issues within a relationship, and a lot of challenges, a sick child, a loss in the family, you can't be happy. Let's be realistic. Actually, it's funny because I have a pillow on that couch right there. And there's on that pillow, there's a whole circle of a bunch of different emotions and feelings that we can experience. We're in a society where, I hate this statement, positive vibes only. Let's get rid of that, right? Because all vibes are accepted, and that's okay. If your child is struggling, be with them in that struggle. Don't try to put a positive spin on everything. Allow that child to grieve. Allow that child to be in pain, because through that pain, they're able to process it and come out on the other side. A lot of the times we want to just make a beautiful, perfect picture and say, live in this, they call it toxic positivity. It's meant to be, it's meant to happen. Just be there with the person when they're in pain. So that's one thing. Another one, did you want to say something?
No, I love it. What's the second one? I'm excited to hear this one.
Another one is our work-life balance, the stress that work brings us also. A lot of the time, people are struggling with the stress at work, and they bring their work home. I'll give you an example. Your boss yelled at you. You can't say anything to your boss. What do? You come home and give it to your spouse, give it to your child. What does that person do? It takes on all of that feedback that you're giving to them, and they carry that now.
Very true.
So just make sure to check yourself. And this is when I talk about emotional availability, recognize these patterns that come up. If you're noticing every time you're coming home, you're starting to fight with your spouse, you're lashing out at your kids because you're hungry, because you're tired, make sure you get that in check. That's another thing. Another one is, a lot of the times PTSD is silent, right? We don't talk about it because people want to hide it. It's important to be able to also check in with your spouse if you notice any patterns that are different. Another one we talked about is substance use, okay? I know a lot of children, young children, are struggling with vaping, weed, a lot of other challenges that they're experiencing, specifically with experimenting with pills. This is something that happens, and a lot of times parents are afraid to have these conversations. Fathers, I know it's difficult for you. I know you're coming from a place of safety and security, and you want to be there for your child, but it's really important with how you talk to your children. Mothers, please be aware of these relationships that are happening in the home. What else do we have to talk about? Let's see.
You got such great points, Avi. Wow, amazing. Thank you for sharing all this, because that is so on point. Everything you're mentioning right now, coming home, you had a crazy day at work. So many people can say they're guilty of that. Let me ask you a question, just because I think it's something very important. Of course, everything you mentioned is important, but this one caught me on. If somebody has trouble, let's say they have a work partner, I'm going to give you this situation. A father and a son are working together. Okay. Now, when you're with a typical boss, let's say, and you want to set your standards, you don't want to take disrespect from anybody, and you kind of will set your boundaries, right? Let's say you have a situation where there's a father and son working together. And now, as a son, you have a certain respect towards your father, and it's like you don't want to set too many boundaries because you feel like he's my father. He tells me something, I have to respect him, and as a respect to him, I listen to him. Now the son, or mother and daughter, for example, bubbles up because he can't really release the steam to his father. He comes home, and who's on the receiving end of all this? The poor wife, right? And this is happening over and over again. And I'm sure the wife recognized it, and she'll listen, you need to change your job. This can't keep happening, but no, it's not possible. It's not realistic. So there are these situations that come into play where it's almost like, well, we are in a very, very fine line here, right? We need the financial support. The parent is supporting. Eventually, the son will take over this business. There's just no way out of this particular situation. So I want to pose this question to you, and I'm not trying to put you on the spot, but I think it's a very important thing to address. What would you tell this person, this spouse who is in this situation? What would be a tip And I know we're getting a very long segment here. We're going to try to wrap out after, so shortly. But what would be a tip that you can share with a spouse who's going through this? How do they release the steam without taking it out on
Mm,
their wife or husband?
yeah. I want to just mention that that spouse who's dealing with all of this is in a really tough spot. If
Right.
I can give a general statement, I would definitely say it's not a good idea to work with your family members.
Mm-hmm.
Now, I'm aware that in some cases it could work, and in some cases it works really well. Beautiful. I'm so happy for you. That's great. However, it makes the job so much more difficult. Why? Because you also, aside from work, you also have a relationship with your parent. So it's almost like now the lines are blurred, right? Where am I, when does my father wear the dad hat? When does my father wear the boss hat? Does that make sense? So
Absolutely.
because of that, the only way this setup would work is if there's a very clear boundaries that both understand. And when it gets crossed, to make sure you check it and make sure you discuss it, because that's the only way that is going to be a healthy partnership. If they want to maintain their relationship as son and father with love and harmony, that is the only way it's going to work. Because if not, the child or the father will carry a lot of resentment, and things that have nothing to do with work will also spill over into their personal father-son relationship and the family dynamics. Mom will get involved, wife will get involved, and it can get ugly.
Love that. Thank you very much. Any other points you have there? They're so
Sure.
important.
The next one is breaking generational trauma. This is a huge one. This is one that I actually spoke with that person today. The person said to me, their parents or their aunts or their uncles, the older people in their families, like, what do you know about depression? Look at my life, what I had to go through, what we went through, right? We had to immigrate. We had such a difficult time. We had this, we had that. Look at your life. You have all this and you're complaining. I'll give you something to complain about, right? That is a huge area that we need to break that cycle. We need to recognize that, yeah, even those people, they may look like they're okay. No, they're not okay. They're not okay because they're holding on to a lot of pain. And you know what? When I work with the geriatric population, so many of them break down and cry. Especially, it's interesting, especially the men will break down on the couch and talk about how much they had to hold on to. So
Wow.
part of the cycle is recognizing and breaking that. Managing our stress levels. That's every single day. What are we doing to release steam? That can be different for everyone. I know we're just spitting out different areas to talk about, but these are different things that should
This is
kind
another
of play in a person's
live
mind for them.
segment. All these points need another live
For
segment
sure.
to break
Exactly.
it all up. These are
Um,
amazing points you're bringing up.
right. I want to recognize, if a person went through trauma in their life, whatever it was at whatever stage, and this trauma, if it was not reprocessed, it is still with you. I'll give you an example. Some One of the things that I work on in my office is helping people overcome their fear, whether it's with dogs or cockroaches or snakes and mice and all that, right? Helping people overcome. So when I work with an adult who is a highly successful, highly intelligent person, 40 years old, 40-year-old adult, right? Has it all together, very smart. When I ask them, when did a dog come and attack you? And they say, when I was 8 years old, a dog chased me. And from that time, I was afraid of dogs.
Mm.
Now, on a conscious level, we're trying to understand, wait, but you're 40 now. You know this is a cute dog. This dog is not going to attack you. It doesn't make a difference because that 8-year-old girl is still trapped inside her body and needs the help and needs the support. If somebody went through sexual abuse or sexual trauma, let's say at 9 years old, and they get married and they have a fear that their spouse is going to touch them and they might panic, that young child is still in their body that needs to be listened to, that needs to be healed in order for them to move forward. So this is what my point of this is saying. when, even though traumatic things happened to us in the past or are currently happening to us, we can absolutely rebuild. And there is a way. There are answers. You might think my situation is the biggest one and there are no answers. No, there's an answer. We can figure this out. Um, this was my piece. This is what I wanted to share. We're in this together. And I'm really, honestly, tonight, I'm really coming from a place of love. And I want to just let you guys know, if you're hearing this and you're struggling with whatever it is, you don't have to walk this walk alone. And there are answers. You might just not, you haven't found it yet, but you can get that answer. To have some peace, to have some clarity. Life can really, I know this might sound so cliche, but life can really be such a beautiful thing. That's my piece.
Avi, literally, for all those that are watching, we made this live within like 15 minutes. We didn't even think we were going to go live today, and we have so much valuable information that we were able to address today. And you pointed out such amazing pointers. I don't know how you had the time to quickly jot all that. I am so glad that we were able to go through with this live, even though not me, not you, none of us even had this. I mean, this was not on our schedule at all tonight, okay? I just think everything that happens for a reason. I feel so empowered. This helped me. I'm sure it helped you in some way as well. This was so empowering, and I'm sure that anybody who joined us late that wasn't able to watch this from the beginning, I highly encourage you to really watch the entire show from the beginning, because I feel like we addressed so many important topics here. We addressed topics that are like, they're real. These are topics that are so real, and I'm so glad that we were able to do this. And based on the list that you prepared, we have a lot more to talk about. So I know that we're both very busy, but we got to get back into our Let's Talk show moment
I
where
would love
we
to.
do these shows all over again, because this is really, really important.
I would love to. And I always, it was, and like you said, for me too, this was so um therapeutic, let's call it, to be able to share my 2 cents, just to give you a piece of my heart. That's really what it is.
Thank you so much for allowing me to have you on the show tonight. Thank you to all of you who are watching. I know there were so many comments that kept coming and coming. We weren't able to go through a lot of them, but we will definitely go through it. If you're watching, like Avi said before, we can never say this enough. If you are watching us and you are feeling a certain way and you really have no one to reach out to and you don't feel well, reach out to us, okay? If we can help you in any way, we will help you. Even if we can direct you to the right source, we're here for you, okay? So no one watching here should ever feel like they are alone. You are not alone. You have a whole community of people behind you. We are such a unified community. I am so blessed and so proud to be a part of this community. We have a GoFundMe page. People pouring in all over, always, no matter how many GoFundMe pages open up. This one had a fire. This one had a challenge. This one had this one had that. I have never seen a GoFundMe page without something being given. We all chip in together and we all make sure we're helping the person. We're amazing. How many organizations we have? Hatzalah, Shmira. We have, we have organizations with, what's the name? Diana Rachnaev. She's watching. Her organization, Yesodot. We have All About Kindness. We have so many organizations that are there for free. Their whole mission is to help people. Their whole mission is, I'm here for you. So we are never alone. We have everybody. We're all united together. So don't ever feel like there's no one with you, because there's always someone there. You are important. Your life matters. You are valued. You are loved. You are special. So once again, thank you all for joining. Thank you, Avi, for being here tonight.
Have
Have
a
a
good
good
night,
night.
everyone.
Bye-bye.